Thank you for joining us for this community briefing on COVID-19 and our local response efforts. Joining me again is interpreter Francis Beauravache, and I want to say thank you again, Francis, for the work that you provide to all our residents, and thank you as well to the media and all who are tuning in to learn more about how you can protect yourself, your loved ones, and our community. We want to remind everyone that you can also find more information at our website, covid19.lincoln.ne.gov. At that site, there is both more data about the testing and investigations of our health department, as well as access to resources that can help you or your business navigate the challenges that we all currently face. That dashboard, once again, is updated twice a day, once in the morning and once in the afternoon. I have some sad news today. In Lincoln, we have confirmed a second death from COVID-19. The death occurred earlier this week and was reported to our local Lincoln-Lancaster County Health Department today. And our condolences go out to the friends and family members of that individual. We've also learned today that in Lincoln, we have had a total of 47 individuals test positive for COVID-19. We reported this morning that 4 individuals tested positive, so since then, another 43 individuals have received lab-confirmed diagnoses of COVID-19. Of the grand total of 509 confirmed cases in Lincoln, 272 of them, or 53%, have been reported in the last 7 days. And here to discuss the Health Department's investigations of these cases is Health Department Director Pat Lopez.
Good afternoon. Our investigations have now identified 183 Lancaster County community members who are positive cases related to the Smithfield plant in Crete. 108 are employees at the plant and 75 are family members or other direct contacts. Of all the positive lab concurrent cases that have been investigated from Lancaster County, 40% have been found to be connected to Smithfield and Crete. Again, the plant is in neighboring Saline County, but we have many Lancaster County residents who work there. We have no new cases at the Smithfield plant here in Lincoln. We still have 9 positive cases related to that plant at this time, 6 employees and 3 direct contacts. The overall positivity rate for Lancaster County remains at 9%. The state and the national rate are both 18%. We've had fewer hospitalizations today. Our hospitals had 43 COVID-19 patients yesterday, and that is down now to 38. That includes 12 from Lancaster County and 26 from other parts of the state. 6 patients are on ventilators. That includes 2 from Lancaster County and 4 from other parts of the state. Our hospital capacity in Lincoln remains healthy. Bryan Health and CHI Health St. Elizabeth drive-through testing sites completed 210 tests. That's 70% of our capacity. So if you have symptoms or COVID-19, you can get tested now. The process starts with an online risk assessment at CHI Health or bryanhealth.com. Again, you must have an order from Bryan Health, CHI St. Elizabeth, or a doctor to be tested. We will have an additional local testing option tomorrow when Test Nebraska is set to begin testing at the Lancaster Event Center in Lincoln. They started testing in Omaha and Grand Island earlier this week. All the Test Nebraska tests done in the state will be sent to CHI St. Elizabeth in Lincoln for results. For more information, you can visit testnebraska.com to complete a risk assessment and see if you're eligible for a test. You must have an order from Test Nebraska to be tested at the site. With our Lancaster County directed health measures scheduled to expire this Sunday night, we have been communicating with the governor's office to coordinate guidance. We have daily communication with other health departments from across the state and with our community partners so we are able to make decisions on what is best for Lincoln. Most businesses have already implemented safeguards to protect employees and customers. These include taking the temperature of employees, limiting occupancy, and structuring workflow to minimize close interactions, placing hand sanitizer at entrances, and routinely disinfecting high-touch areas. They are also making sure employees and members of the public wear cloth face coverings. The health department is finalizing a variety of guidance documents to include the constructive input we received from numerous local businesses. When they are finalized, these documents for specific types of businesses will be posted on the city's COVID-19 webpage to provide clear guidance on protecting the health and safety of the public and the people who work in these areas. With any gradual return, some things will remain in place. Large public gatherings and events will still not be allowed. We must continue to ensure that medically vulnerable people are protected. These include people age 65 and older, people who live in nursing homes and long-term care facilities, and people with underlying medical conditions. To prevent the spread of COVID-19, we all need to use our best judgment. Stay home as much as you can. Continue to protect yourselves and others around you by wearing a cloth face covering. Stay at least 6 feet away from others. Wash your hands thoroughly and often, and regularly disinfect surfaces. We need everyone to continue to do your part to prevent the spread of this virus.
Thank you, Director Lopez. Today we're going to spend some time talking about directed health measures and the considerations that inform our local strategy for adjusting those measures. First, we want to emphasize that this is a time for caution. We have a high-risk situation in Lincoln and Lancaster County. 2 of our key metrics, our case numbers and our positivity rate, are trending in an upward direction, the wrong direction, according to guidelines from the White House Coronavirus Task Force and the experts at Johns Hopkins University who've been guiding and advising us and who have done so much to inform the world about the current state of the pandemic. Our concern for our community is that while we know that the increase in cases and the increasing positivity rate is largely attributable to a specific outbreak, we also know that Lincoln is at a higher risk of community spread cases developing as a result of that outbreak. We will be closely monitoring this and continuing our efforts to support the successful isolation and quarantine of these individuals. This high-risk situation we find ourselves in is why we want to be clear that all of us still need to exercise great caution. Our physical distancing measures have done so much to keep our community safe. And this is not the time to ease off on these common sense steps that Director Lopez outlined, as they are vital to preventing transmission of the virus. With concerns about our local situation in mind, we worked with the governor to extend our current DHM from its original May 6th expiration date. And we really appreciated that extension and have continued to impress upon the state our concerns and our desire for even a lengthier extension. One that gives us time to understand the full impact of the Crete outbreak in our community, ideally to see a greater containment of the outbreak at the Smithfield plant in Crete, as evidenced by a leveling off in case numbers and positivity rate. An extension that would enable us to get the expanded testing from Test Nebraska up and running and a chance to look at the results from those tests done here in Lincoln, results that would provide a more clear picture of the prevalence of COVID-19 in our community. And we are grateful to have that expanded testing headed our way. And an extension that would also be advantageous in providing affected businesses with more time to secure face coverings and other PPE that's crucial to their safe resumption of operations. We were then, of course, disappointed to hear the governor's remarks during his briefing earlier this week that he would entertain no further extension of the state's current DHM for Lancaster County. Our goal, to be clear, has always been to be working in sync with the state to protect the public. Clear and unified guidance to the public is important for enabling people to navigate this pandemic safely. Confusion about what's allowed by one level of government or the other is not helpful to anyone. Rather than create confusion between the state and the county or engage in a legal battle, we will also issue a local DHM that aligns with the state's, taking effect on May 11th. And these new local measures will allow restaurant dining rooms to operate at 50% capacity with guidelines around physical distancing, hygiene, face coverings, and other measures. Allow beauty and nail salons, barbershops, massage therapy services, and body art establishments to open while maintaining the 10-person rule with employees and customers wearing face coverings. And allow childcare facilities to have up to 15 children per room. And as discussed before, the state has also implemented new guidance for faith-based services held in houses of worship and elective surgeries, which went into effect on May 4th. Apart from these adjustments, the 10-person public gathering limitation will otherwise remain intact. And we are glad to be in agreement with the governor on this very important safety measure. I want to be clear. These directed health measures provide the foundation for our next steps forward together as a community, but we can also do more. We are asking our community members to be vigilant and to think not just about what you can do, but also what you should do, taking into account local conditions. Now is the time for all of us to exercise personal and civic responsibility to our neighbors. If you live in Lincoln, this means continuing to limit your non-essential travel and only shop for groceries and other necessities once a week, and to wear a cloth face covering when in public, and to keep 6-foot distance from others outside your household, to continue to wash your hands frequently and thoroughly. As we've said, COVID-19 is in our community, and residents should know that they are at risk of contracting the virus when they're out in public. If you're a business, you should make any plans to expand your services in a safe and thoughtful manner. And this means looking closely at the state and local guidance that have been drafted and various business operations, and building up your supply of face coverings, hand sanitizer, and other PPE so that your staff and patrons will be safe at your establishment. And it also means configuring your establishment to allow for 6 feet physical distance between persons to the maximum extent possible. We, here at the Lincoln-Lancaster County Health Department and locally, plan to work closely with businesses, as we have throughout the pandemic, to help them build the capacity and develop the plans they need to operate safely. And to that end, we will be announcing an economic recovery task force in the coming days, which will be tasked with, among other things, helping organizations understand and comply with both the state DHM and our local health guidance. We plan to work with our partners in the business community to help direct people to where they can purchase PPE from local suppliers. This will help people not only adopt good health practices, but it will also give people an opportunity to support local businesses and our local economy. In addition, we are in the process of developing a dial that will give residents a sense of where our community is in terms of the 5 key metrics that I've discussed in the past and the overall risk that the virus poses to our community. This dial will give residents a better idea of how they should be calibrating their actions and decisions to protect themselves, their loved ones, and their neighbors. Think of it as a forecast. This crisis is uniquely challenging. It's challenging because of, as I've said before, the situation on the ground and our data are constantly evolving. It's challenging because, however you slice it, there are significant health, economic, and social considerations at stake, lives and livelihoods. And balancing those considerations is not a black and white endeavor. And it's challenging because we're dealing with a long-term horizon for this virus. All we can do, and all anyone can do, is make decisions based on the best available information we have at the time, consistent with our values and best judgment, and consistent with our understanding of local conditions. We ask Lincoln residents and businesses to continue to be thoughtful, measured, cautious, and compassionate as we all navigate these challenging times. And to conclude with some good news, Lincoln residents are continuing to do a great job completing their census forms. Lincoln has the highest self-response rate in the nation for all cities with populations over 250,000 people. Lincoln's rate is 71% compared to the national rate of 57.7%. And Nebraska currently ranks 4th among the states at 64.6%. And this is such good news because the census is so important in determining how federal aid comes back to our community, and that's especially important now as we look to recover from the pandemic. I want to thank our local Complete Count Committee for doing such an outstanding job. If you have not yet completed your census form, you can do so online at census.gov. It's quick, it's easy, and it's completely confidential, and it's very important for the future of our community. With that, we'd love to open it up for questions from the media.
Mayor Riley Johnson with the Journal-Star.
Hi, Riley.
Hi. Is it the city's legal understanding that essentially a state DHHS directed health measure supersedes all local directed health measures, and that any legal battle the city would engage in would be an uphill fight?
The answer to that question is not clear, Riley. But what we know is that we want to stay focused on public health, and that this is not a time to be fighting in the courts. We care mostly about the court of public opinion right now, and we will continue to offer our public informed, accurate, honest opinions about what is best for them to stay safe and healthy. And that's what we're going to continue to focus on going forward.
Follow-up question, maybe for Director Lopez, maybe for you. We've heard from some bar owners about sort of their exclusion from the easing of dine-in allowances that will be under the eased restrictions. Could you maybe speak to the decision-making on that and in not allowing sort of some occupancy at taverns?
Let the health department take that one. That guidance did, of course, originate in the state. It's DHM, and I'll let Director Lopez get into the details.
Afternoon, Riley. I think our understanding is that bars were excluded because in a restaurant setting, people come in, they eat, and then they leave. Whereas in a bar setting, people are in closer contact with each other, and they're really there to socialize for a time being, and will be in the situation and the environment for a longer period of time.
Director Lopez, follow up to that. For the businesses that under the new DHM coming Monday, how does the health department foresee enforcing the requirements for patrons and staff at certain establishments like barbershops to wear masks?
We provided a lot of guidance to those establishments, and they have been in contact with us, and we have a mechanism for people to contact the health department, and we've been following up with the current directive health measures as necessary. And really what we found, Riley, is that our businesses are very compliant, and we anticipate the ability to be open and doing business. We know that these business owners are very concerned about the people that come in to them and care about them and want them to be safe as well. So we anticipate there will not be much of an issue with compliance.
This is Bill with 1011. I think my question's probably for the mayor and maybe you too, Pat, but I'm curious as to when the final decision was made to not change the directed health measure and what kind of, last minute discussions there were with the states.
I think, we've been working through that all week, Bill, and kind of came to the point in our discussions and where we were at and what was best for our community, kind of finalized early today about where we needed to go and what was going to be the best direction so that we could continue to provide that transparent information to the community and provide the best guidance and stay focused on our community's public health.
Director Lopez, on the death that was confirmed today, can you talk a little bit more about that case? Was it somebody who was a known confirmed case to the health department, or was it a postmortem diagnosis? Or can you speak to where were they hospitalized?
This was a known person who was positive for COVID-19, and they were receiving care in the hospital.
Considering that you guys asked the state for an extension to the directed health measure, is it fair to say that you would advise the people of Lincoln to act as they are acting now, and maybe not visit a salon or a restaurant if they can hold off? Or would you encourage people to go forward?
I know a lot of us want to go forward. A lot of people want to move forward. But I think if you heard the mayor, we're really encouraging people to be very cautious right now. And if you have, if you're over 65, if you have any other health problems, if you take a medication a day, you do have a health problem, but we really want people to only be going out for essential needs right now.
I'll just add, Bill, that our health department has been doing incredible work to support the safe resumption of operations of businesses that have been impacted by the directed health measures, as well as any business that wants to call and seek support and guidance. And what we can say about Monday is that any establishment that is resuming operations is in a much better place than they were when our directed health measures went into effect in March. We feel much more confident about their ability to safely resume operations because they have been involved in developing guidelines, providing feedback and information. They will have additional protective equipment. They will be expected and informed about the value of their disinfection and sanitization routines. So we've come a long ways from when these directed health measures went into effect. I think our sense of urging caution in the community is really more about the fact that we don't want this resumption of operations to be interpreted as a diminution of the threat of the virus. People need to understand that with our rising cases and our rising positivity rate, and with currently today not significantly expanded testing, we believe that we don't have a true sense of the prevalence of the disease in our community, and we know that we're at risk for it growing based on the outbreak. So please use good judgment, make informed decisions, and we will, again, be supporting people's ability to make good decisions by bringing forward sort of our local indicator, a dial that will give people a sense of the risk level on a day-to-day basis and how they can react to that risk level when they make their decisions.
Are you able to say what date you would have preferred, or the extension date that you guys were eyeing?
You know, I think there's no magic date. That's the hard part about this, Bill. There's no guarantee in a pandemic. As we continue to flatten the curve, we don't know when we might see the peak. But I think what we were acknowledging is that we're on the upside of any curve or plateau that we're on, and we would love to get to a place where we felt a little more confident about the numbers stabilizing. And we hope that they will stabilize. And we've seen such great compliance in our community. Part of the reason that we don't have as many cases and that our hospital capacity is not maxed out is that our public has taken this really seriously. People have made wise decisions about limiting their physical interactions with other people and have stepped up their hygiene routines and are respecting the needs to wear a face covering to protect those around them. So, you know, another week or two would have given us more time to secure, as I mentioned in my remarks, secure access to PPE for businesses that are trying to get it. It would have allowed us more time to see if we've got the outbreak in Crete in our community stabilized. And We, think that that would have been useful time, but there are no guarantees. And so we will just stay on our message that people should be cautious, that there is a risk anytime you're in public of being exposed and contracting this virus. And frankly, this is a message we're going to continue to give over the long haul. We will be shifting in the coming weeks to sharing how we all need to think about the long-term plan of navigating life in a pandemic until there is a vaccine or better antiviral treatments. And so our goal moving forward will be to guide people's decision-making, help them protect themselves, their loved ones, and our community, recognizing that we're all going to have to figure out how to live and coexist with a virus that is novel and highly contagious.
Follow-up question from Ron.
We know that things can't stay closed indefinitely, and we know that there are other impacts of this pandemic besides the public health threat, and so we are trying to strike the right balance for our community of assessing risk and moving forward in our recovery from all aspects of this pandemic.
Riley with the Journal-Star here. What confidence does the health department have right now in its ability to do the contact tracing and isolate the cases related to the outbreak that you guys have in your jurisdiction?
Well, they have great confidence right now in the environment we're in with the current number of cases that we have. But if we were to see, potentially large flare-ups in the future, we're very much interested in growing our capacity in order to make sure we are always able to meet the current demand. And like I have said, is that this is going to be an evolving situation. There will be some days with low cases and some days where we may need to, ramp up our testing, our contact tracing. We've got a lot of people at the health department who are working long hours, and we recognize that this is a marathon and not a sprint. We're going to need some backup over the long haul to make sure that we can continue to turn around results that allow us to isolate and quarantine people quickly. And we're looking forward to the fact that the state is building up capacity for that. We hope that that is a successful endeavor. We want the state to be as successful as we are at the local level. We are all in this together. So we will continue to work to grow capacity. We're so grateful to LPS and the school nurses who have great training and who are going to be coming online to support our local health department in the coming weeks. But we are very interested in ensuring that we have significant capacity to expand and contract as the virus demands. Did you want to add anything to that, Pat? I'll let Director Lopez follow up on your question, Ryan.
Today, Riley, I think I mentioned earlier this week, we added 11 nurses from LPS that are going to be working with us. So that's also increased our capacity. We've been able to address the demand now, but we really want to make sure that we're prepared, as the mayor said, for the ebb and flow of the virus over the longer period of time. And having the school nurses available to us is going to give us even a little bit more time to see how the virus continues to unfold in our community.
Can you speak to how many people your staff are monitoring for symptoms and potential testing needs?
Riley, I'm not sure of the number right off the top of my head, but I could tell you, I'm not sure how many we have right now that we're monitoring. Every morning we look at it and then update it, so it's not clear to me on my head. I have my paper here. Thank you. So we have 6 cases, test results pending in the public health lab, but we're monitoring 712 people.
This is Bill with 1011 again. Director Lopez, the governor had mentioned today that a lot of the cases and even more of the fatalities are tied to these long-term care facilities. I was wondering what you have seen locally here in Lincoln in regards to long-term care facilities and whether there are any outbreaks that we should be aware of.
You know, we keep in close contact with the long-term care facilities, as I mentioned, and work with them on a daily basis. We're continuing to monitor a few situations right now, but we really don't have an outbreak situation at this point, Bill. But that could all change, overnight, the way the virus works. But our facilities have done a lot of work to ensure the safety as much as possible with all the guidance that's been provided to them. And also, I don't know if people realize either, the long-term care facilities are regulated by the state, but we also have contact with them immediately with the state and the long-term care facility if there is any activity to make sure that we can address that concern and isolate it right away.
Are there any further questions from the media? All right, well, thank you for tuning in. We'll be back tomorrow at 3:30 with more information. We hope everyone will take great care and keep each other safe and healthy, and we'll see you tomorrow.